guys, Dr. Carrie with Mother Goose Chiropractic here, and today I wanted to talk about some of the common causes of pain during pregnancy. So pregnancy, we've got a lot of things going on with our bodies. We've got different hormones going, we've got structural shifts happening. We've just got a lot of stuff that our nervous system needs to be able to handle and adapt to. Some of the most common ones we see in the office, of course, is going to be low back pain. Low back pain, why? Well, as that belly grows, we get that anterior pelvic shift. So baby's growing out, mom's body's trying to shift to compensate for that. The center of gravity shifts forward. It puts an extra strain in that low back and can cause issues and pain and pressing on those nerves in different ways. And so we always kind of look to see what's going on structurally, where those shifts are happening, and start to address that and address the soft tissue as well. And when that happens, a lot of times the pain disappears. Pain's kind of like the tip of the iceberg. It's normally the last thing to show up and the first thing to go, which is good and bad, right? Because no one wants to be in pain, especially during pregnancy. Another common pain area is just pelvic pain, or especially like pubic symphysis, that front of the pelvis. And that happens when we get not only that anterior pelvic tilt, but a lot of times we can get kind of that shift happening in that pelvis. And we've got basically soft tissue that sits between it, and it can kind of pull and move, and it kind of just puts pressure and strain in there. And so again, we want to make sure that that pelvis is sitting there properly and that there is no kind of misalignment or subluxation in there, and that everything is structurally where it needs to be so that it doesn't create any pain, any issues. As well as people come in and you'll hear about round ligament pain. So that front kind of two ligaments that sit in there that hold our uterus in there. So we'll get pain in those because the pelvis shifts, your uterus sits in there like a balloon, and it's held by ligaments, those two in the front, the round ligaments, and it's kind of like pulling at them, you know? So when we get that pull in there, it's not going to be comfortable. So part of our analysis is to address the structural shifts, but to release the soft tissue as well, so that it releases the uterus, but it releases the pain and the stress and the strain and everything that sits kind of that pelvis, that anterior, all of that part that we have down there where baby is. And that's a lot of times how we address issues with breech babies. So we use the Webster technique. We do not flip breech babies. What we do is we create the space for the baby to flip by themselves. So like I said, the pelvis sits there, uterus sits inside, it's connected by ligaments. If we get a shift in our pelvis, it creates a pull on those ligaments, and then it creates like a balloon twisting to our uterus. So what we do is we work to take the shift out of the pelvis, release the ligaments, untwist, basically your body will naturally release the tension that's on the uterus, and so that the baby now has room to flip head down. So that's basically the technique we use to help baby have plenty of space so that baby can flip when it is time to flip. Another thing that we see a lot of are kind of your headaches and nausea and things like that that go along with pregnancy. Like I said, we've got a lot of structural shifts going on in our pelvis, but that's going to translate all the way up your spine, and it translates to your neck as well. A lot of times our moms get what we call mom shoulders, and so we've got kind of that we're forward with everything, right? And especially once baby gets here, we're definitely forward, because now we're holding baby, we're taking care of baby, we're doing all the things forward and not bringing ourselves back to reset where we need to be. And so we get a lot of issues kind of along the neck, and tension and twisting and all that kind of stuff, subluxations in the neck that we get addressed, we get released, headaches start to go away, nausea starts to lighten up, because now your body can kind of communicate with itself and say, hey, you know, we're talking back and forth, things are moving, we're where we need to be. We'll also see sciatica. That's a common hot word. And so that's going to be pain in the low back that travels down your legs. And that's basically pain and pressure on that sciatic nerve. So same thing, that pelvis shifts, that low back shifts, those nerves come out of your low back and they travel down your legs. The muscles tighten up. A lot of times in pregnancy, our muscles tend to not be as strong as we would like them to be. This is why adding different exercises and things like that is going to be key and part of your care, because we want to make sure that your body is as strong as possible going into labor and delivery. Labor is like a marathon. So guess what, mama, you got to train for it. You know, it's not just, you know, chilling out on that couch and letting the baby grow. It's really working your body to be able to run the marathon when it's time. And so sciatica is normally shift in the pelvis, shift in the low back, and then muscles that kind of clamp down around it. And we work to basically undo all that pressure, release everything, give you the strengthening techniques that you need to support that area, so we can kind of build on it as pregnancy care goes along, so that you're feeling your best and that we're getting the results that you want, and that when it comes time for labor and delivery, we're not having, you know, any of these issues. Your body's ready to go, you're strong, you're ready to run that marathon and rock and have amazing labor and delivery. And these are a lot of the common causes that mom comes in with. A lot of different, obviously like pain type things, but some moms come in, they're just like, listen, I feel like junk. I have no idea, just all over, I feel like junk, and I just want the best pregnancy possible. And those are always my moms. I'm like, yes, let's do it. I love to hear that. Love to hear when mom's like, I know that this is a very important time in my life. I need to optimize the way my body is healing, the way my body is functioning. And that's exactly what we do. We make sure that your brain and your nervous system, everything is communicating at 100%, so that you can have the best pregnancy with the least amount of aches and pains and kind of all these symptoms popping up without that. And that when it comes time for labor and delivery, things can be as smooth as possible. So we would love to answer any more questions that you could possibly have. MotherGooseChiropractic.com is going to be a great resource for you. Or just give us a call or shoot us an email. We'd love to help. Bye, guys.